lining up to test for the coronavirus. Anyone who has a fever has to stay outside. A checkpoint outside of Sana'a. It's to protect the metropolis of millions from an outbreak.
We transfer people who are suspected to have coronavirus to the hospital or various hotels suitable for quarantine.
Officially, there's only one case of COVID-19 in Yemen. In reality, there may be many more. That's bad news for this troubled country. 5 years of war between a Saudi military coalition and the Houthi rebels have devastated the country's infrastructure. Almost 50% of all hospitals have been destroyed. Saudi Arabia has declared a ceasefire, but it's a fragile one. People don't have enough food, water, electricity, or medicine. Many people are suffering hardship and hunger. Washing their hands is almost impossible. The Zayed Hospital in Sana'a is still operating. It is one of 2 with intensive care beds for coronavirus patients. There are only 6 respirators here. There are 12 in total in the whole capital.
The clinic is large and located in a sparsely populated area. That's why it was chosen to fight the disease.
A start, nothing more. The UN has warned that the delivery of urgently needed aid is considerably more difficult because of the sea and air blockade of Saudi Arabia.
Supplies which the United Nations are trying to bring into the country, life-saving supplies, ICU supplies, the medicines that are needed. It's been difficult to do that because of the blockade.
Cholera and diphtheria waves have weakened millions of people in recent years. This makes becoming seriously ill with COVID-19 even more likely. Deficiencies also in pharmacies. Masks and disinfectants are not available or only at extortionate prices.
I can't find a mask. Wherever I look, there are none. First, they cost 20 riyals. Now it's 1,000.
Shortage and need are already a normal state of affairs in Yemen. A coronavirus epidemic could dramatically worsen the desperate situation of millions of people.
I'm now joined by Lisa Grande, the United Nations resident coordinator in Yemen, who is leading the UN's emergency operation there. Ms. Grande, what are the challenges of tackling coronavirus in Yemen?
We expect that coronavirus, unless if it's checked, it could spread faster, more widely, and with deadlier consequences in Yemen than in almost any other country in the world. Right now, our biggest concern is supplies and preparedness. We estimate that if the virus takes off and transmission cannot be suppressed, that at the height of the crisis, we would need 200 hospital beds across the country. Right now, there are only 35,000. We predict that we would need 32,000 specialized beds, ICU beds. Right now, in the whole of the country, there are only 500. There are only 200 ventilators for the entire country. 400 more may be coming in, but that's clearly insufficient. We don't have enough testing kits. We don't have enough protective gear. And even if we can get the supplies, we have to get them in. If we bring them in by port, it's closed. If we try and bring them in by air, the airports are closed. If we try and move them by road convoy, they're stopped at checkpoints. And then there's a third problem, and that's funding. Already we are facing a major funding crisis. Of the UN's 41 major programs, 31 of them are closing or shutting down this month alone because we don't have the funding. It feels as if the odds we're facing are insurmountable.
Lisa, years of deprivation and malnutrition during this war have left large parts of the population, of course, in poor health and with weakened immune systems. Can you tell us more about the particular dangers that the coronavirus poses to the people in Yemen?
80% of the entire population in Yemen requires some form of humanitarian assistance or protection in order to survive. The population has one of the lowest levels of general immunity in the world and one of the highest levels of vulnerability. Half of the entire population every day wakes up hungry and depends upon the United Nations for their food. 7 million people in this country are malnourished. 2 million of those are children. We know that if the virus is not suppressed, if it impacts the population, that the impact is going to be catastrophic. It could be the worst crisis facing Yemen in 100 years.
Do you think this ceasefire that is now in place will actually help for more emergency aid to reach those most in need?
The people who are crying the loudest for this ceasefire are the people of Yemen and humanitarians. The ceasefire will make all the difference in the world. It will mean that we can bring in supplies and we can get them to the people who need it. It's going to be tough, even with the ceasefire. We're going to have to do everything we can, but we can't do what needs to be done without the ceasefire.
Lisa Grunder, United Nations Resident Coordinator in Yemen. Many thanks.